Hello guys, welcome to my YouTube channel. My name is Mohammed Shhezad and I'm a PharmD third year student at Geethanjali College of Pharmacy. Let us begin the case presentation on lipoma. Introduction to the lipoma. A lipoma is a slow-growing fatty lump that's most often situated between the skin and the underlying muscle layer. A lipoma is not cancer and usually is harmless. Lipoma can appear anywhere on the body, but they are most common on the back, trunk, torso, arms, shoulders, and neck. Types of lipoma based on the location and characteristics. Subcutaneous lipoma. This is the most common type of lipoma and develops in the subcutaneous tissue, which is the fatty layer just beneath the skin. Subcutaneous lipomas are usually soft, movable, and painless. Intramuscular lipoma develop within the muscle tissue. They can cause discomfort or pain if they compress nearby nerves or muscles. Intramuscular lipoma may be firmer to the touch compared to the subcutaneous lipomas. Angiolipoma are lipomas that contain a significant amount of blood vessels. They appear as soft, compressible masses and may be more tender compared to the other types of lipomas. Fibrolipoma contain a combination of fatty tissues and fibrous tissue. They tend to be firmer and may have more rubbery consistency. Fibrolipoma are often found on the upper back or neck. Spindle cell lipoma are characterized by a higher proportion of spindle-shaped cells. They are typically found on the back, shoulder, or neck. These lipomas can be softer or firmer in texture. Pleomorphic lipoma are a rare type of lipoma that typically occur in older adults. They may contain a mixture of fat cells of varying sizes and shapes. Pleomorphic lipomas are commonly found on the back, neck, or upper arms. Myelolipoma are lipomas that contain mature fat cells along with other cells found in bone marrow. These lipomas are often found in the adrenal glands and are typically asymptomatic. Coming to the etiology, the cause of lipomas is not fully understood. They tend to run in families, so genetic factors likely play a role in their development. Some conditions causes multiple lipomas. Dekran's disease, a rare disorder, causes painful lipomas to grow most often on the arms, legs, and trunk. Gardner syndrome causes lipomas and a range of health problems. Hereditary multiple lipomatosis. This is disorder is inherited, which is passed down through families. Madelung's disease. This is a condition occurs most often in men who drink alcohol excessively. Causes lipomas to grow around the neck and shoulders. Other conditions such as high cholesterol, diabetes, obesity can also cause lipoma. Pathophysiology. The exact pathophysiology of lipomas is unclear. A simple flowchart, we can be knowing how the lipoma formations are taking place. Genetic factors, if they are present, then there will be genetic predispositions. That means if a parents are having the lipomas, those genetic factors will be inherited to their children and they will be having the chances of getting lipomas. And hormonal imbalances, this will alter the adipose tissue's metabolism. Trauma or injuries to the skins, then this will damage to the adipose tissues and adipocyte proliferations will further lead to the formation. Moving to the symptoms, lipomas are not usually painful, but they can be uncomfortable if they press against a nerve or develop near a joint. So, lipomas are usually encapsulated, painless, round or oval shaped, movable. Most lipomas are small, under 1 centimeter in diameter, but can enlarge to sizes greater than 6 centimeters. Diagnosis and treatment. Usually, to diagnose a lipoma, a physical examination is performed, and if the physician is unable to characterize it is a lipoma, then he may prescribe a biopsy. A sample, remove a small sample is removed and sent it for the lab examination. And An X-ray or other imaging test such as MRI, CT scan, it is performed if the lipoma is large and has unusual features or appears to be deeper than the fatty tissues. There are no cure of lipomas, but there are treatments available to make them smaller or remove them entirely. Surgical excision by removing them altogether through surgery. Uh, in picture you can see the surgical excisions. Small incisions are done and the lipomas are removed. Injections inject medications directly into the lipomas to break them down or shrink them. The steroid injections will be given at the site of lipomas, which will help in the shrink of the tumor. Liposuctions are the non-surgical non-surgical treatments in which uh, the suction is done through the small syringe to draw out the fatty tissue. Here is the case study on lipoma. A 30 years old male patient was admitted in the department of male surgical ward with its chief complaint of swelling in the right lower part of thigh. Incidence onset not associated with pain. He is having the history of diabetes and under the medication injection Glaritas 10 units, a tab, Medimet G1, and the lab investigations were performed. CT right femur was done, in which approximate 14 into 10.2 into 1.9 cm size intramuscular lipoma is noted in the posterior aspects of distal thigh in right abductor magnus. MRI study of right thigh, about 15 into 6.8 cm intramuscular lipoma in the posterior-medial compartment of distal thigh, and the venous Doppler study of right lower limb, mild prominence of GSV, large lipoma in the lower third of thigh. Based on this subjective and objective data, it was diagnosed as lipoma. Here is the treatment plan for the patient. The lipomas are removed through the surgical excision and the surgery was performed on the 19th of December 2022. And here are the some medicines which were prescribed for the patient pre-OP and after op of this post-OP. Pre-OP post-OP medicines are here. So injection taxane, that is the generic name cefotaxime, it is an antibiotic. Mechanism of action is worked by the inhibiting bacterial cell wall biosynthesis. It was given on the day 18th of December 23. And injection amikacin, it is an aminoglycoside antibiotic used to treat serious bacterial infections. And mechanism of action is bind to the 30th bacterial ribosome subunit, resulting in interference with a reading of the genetic code and inhibiting a protein synthesis. That is given on the day 22-23. As the patient having the lipoma, there may be a chances of getting the bacterial infection before operation and after operation. So at the site of surgery, there may be chances of growth of the bacteria. So that is why those antibiotics are prescribed. And injection Glaritas is a insulin glargine. Its therapeutic benefit is it is used in the treatment of hyperglycemia. As the patient is having diabetes, so this was the medicines which he was taking previously and at the time of before surgery and after surgery also it was after surgery it was given. Insulin and its analogues lower blood glucose by stimulating peripheral glucose uptake, especially by skeletal muscles and fat, and by inhibiting hepatic glucose production. Tab Medimed G. It is a combination of glimepiride 1 mg and metformin hydrochloride 500 mg. It is also used in the treatment of hyperglycemia. Glimepiride increases the effect of beta cells insulin secretion and it also decreases the production of hepatic glucose. Metformin decreases the production of hepatic and GI glucose absorption. It also increases the insulin sensitivity. It was given from the day 20 to 25th. Tab-cefacine, it is cefuroxamine. It is an antibacterial. It works by stopping the bacterial cell wall synthesis. Tablet pantoprazole. It is an antacid. It by mechanism of action binds to the hydrogen potassium ATP pump to inhibit gastric acid secretions. It was given because uh, injection diclofenac and tab-hyphenac. These two are NSAIDs. NSAIDs may cause gastric irritations, so to subsidize that effect, pantoprazole was given. And injection Zofar, it is an antiemetic, block the action of serotonin that cause nausea and vomiting. To prevent the nauseatic feeling, the Zofar was given injection, and tab-restal alprazolam for anxiety. It reduces the nervous tension by slowing down the movement of chemicals in the brain. Tab-dofalac, lactulose, it is an laxative, works by increasing stool water content and softening the stool. Injection xylocaine, the lidocaine hydrochloride, local anesthetic, acts on the sodium channel, inhibits the ionic fluxes, thereby affecting local anesthetic action. And injection tetanus toxoids, immunobooster, block the release of inhibitory AA transmitter GABA and glycine, leads to spastic form of paralysis. These are top are given pre-OP. And the below one, injection diclofenac, tab-hyphenac, tab-limc, tab-chimeral ford. These were given after after the operation. Tab-limc is an ascorbic acid vitamin C supplement. Stimulate the immunity and increase the red blood cell production to prevent anemia. For increasing the immunity and uh, fast recovery of the wounds after the surgery. So that's why vitamin C supplement is given. And tab chimeral food is a trypsin and chymotrypsin treatment of pain and inflammation. Mechanism of action helps in proper digestion and absorption of protein, so that helps in reducing inflammation and helps in prevention. For treatment of pain and inflammation after the surgery, and for relieving pain, NSAIDs are given after surgery. Clinical pharmacist intervention in lab investigation. MRI report of right knee joint was taken. In that, chronic anterior cruciate ligament tear was observed, but there is no medicines or treatment given for this condition. Hence, appropriate management must be implemented. The appropriate management medications can be non-steroidal anti-inflammatory drugs (NSAID) can be used to manage pain and reduce inflammation in the knee joint. And the surgical options are ACL reconstruction. This surgical procedure is typically recommended. A torn AC, the surgical procedure for or ACL reconstruction is a torn ACL usually is treated with a procedure called an ACL reconstruction. Surgeons replace the damaged ligament with new ACL graft tissue, either from the patient's own body, that is the tissue from the main patellar tendon or the hamstring, or donated from the someone else, called an allograft. So based on the graft, the reconstruction surgery will be performed. And the physical therapy after ACL reconstruction, rehabilitation is followed. Following ACL reconstruction surgery, a comprehensive rehabilitation program is essential. Physical therapy will focus on restoring knee range of motion, improving strength and stability, and gradually reintroducing functional activities. Physical therapy, range of motion exercises and strengthening exercises, lifestyle modification, weight management, and a knee brace to add the support. Drug interactions in the treatment plan was found to be diclofenac and amikacin. These both were having interactions. In diclofenac increases the level of amikacin by decreasing renal clearance. So that is why monitoring of glomerular filtration rate is required. Coming to patient counseling, will take 10 to 14 days to heal for stitched wounds, so avoid heavy exercises or anything strenuous. The lipoma surgery, it will take 10 to 14 days, and stitching the wounds, it may take time, so avoid heavy exercises or anything strenuous. And fresh fruits and vegetables like cranberries, red grapes, peaches, raspberries, strawberries, watermelon, papaya, spinach, and tomato are excellent sources of fiber, vitamins, and minerals that supports healing following surgery. Keeping the incision area clean and dry to prevent infection. Avoid touching or scratching the incision. Massaging the scar gently once it has healed to help minimize its appearance. Avoid alcohol consumption, as the patient was alcoholic, so consumption of alcohol should be avoided. It may also causes the chances of formation of lipomas. So alcohol consumption should be avoided. References. Thank you.